Welcome to Angels online platform. Test day 27th April 2026. 12th AA Neet. Question number 91. Almost all the aquatic animals excrete ammonia as nitrogenous waste product. Which of the following statement is not in agreement with this situation? Ammonia is easily soluble in water. Correct statement. Ammonia is released from the body in a gaseous state. Ammonia is highly toxic and need to be eliminated when formed. So B option is not a correct statement or not in agreement with this situation. Okay. Question number 92. Principal nitrogenous excretory compound in human is synthesized in. So it is synthesized in a liver. Which of the following organism gives a correct characterization of animal according to the type of nitrogenous waste? So here ammonotelic organisms are aquatic animals, urotelic organisms are terrestrial, amphibian and human, and uricotelic organisms are pigeon, lizard, cockroach, etc. So C option is correct. Question number 94. Which of the following options show a correct matching pair? So correct matching pair is a man and urotelic. Question number 95. Match the column 1 and 2. So first, nephridia is present in annelids. Then Malpighian tubules are present in an insect, and antennal and green gland is present in a crustaceous organism. So here option C is correct. Which of the following statement is incorrect? So in ureotelic organism, ammonia is not a product of metabolism. So it is an incorrect statement. Question number 97. Which of the following options show correct measurement of adult human kidney? Okay, so length is 10 to 12 centimeter, width is 5 to 7 centimeter, and thickness is 2 to 3 centimeter, and weight is 120 to 170 gram. So option A is correct. Which of the following is a correct pathway to passage of urine in human? So from collecting duct to ureter to urinary bladder to urethra. A option is correct. Question number 99. Read the given statement. Urinary bladder dilate a good deal as urine trickle into from ureters, and urinary bladder is lined through a transitional epithelium. So both are correct. You have to label a diagram. So option label A is calyx, label B is cortex, label C is renal column, and label D is ureter. Question number 101. The basic functional unit of the human kidney is. So basic functional unit is nephron only, C option. Which of the following is not correct with respect to human kidney? Blood enter glomerulus through efferent arteriolar. It is a incorrect statement because it entered through efferent. It is entered through efferent alveolar. Question number 103. Malpighian body is constituted of, it is a glomerular and Bowman's capsule. Which of the following statement is correct? Bowman's capsule and glomerulus together constitute renal corpuscle. D option is correct. Question number 105. The number of nephron in a kidney is equal to a number of Bowman's capsule. Which of the following statement is correct? Ascending limb of the Henle's extend as a DCT is correct statement. Again match the column. Deliver blood to glomerulus, it's renal artery. Carries urine to pelvis, it's collecting duct. Then collect to filtrate from Bowman's capsule, so PCT. And then loop of Henle has ascending and descending loop. Okay, so here A option is correct. Collecting duct coverage and open into dash through medullary pyramid in calycis. So it open into renal pelvis. All Bowman's capsule of the kidney are found in. So it is found in cortex only. Of the total nephron, juxtamedullary nephron constitute 15% part. A fall in a glomerular filtration rate activates. So it activates JG cells or juxtaglomerular cells to release renin. Juxtaglomerular apparatus is made up of. It is made up of juxtaglomerular cell, macula densa, and lacei cells. The maximum amount of electrolytes are reabsorbed in. So it's reabsorbed in PCT. Okay, again read the statement. Reabsorption in this region is minimum. This region plays significant role in maintenance the high osmolarity. So it is a function of loop of Henle. Select the correct option. So glucose absorption is in PCT. Then amino acids again in PCT. Inorganic ions in PCT, and urea is ascending loop of Henle. So C option is correct. Which one of the following statement regarding to excretion by human kidney is correct? So nearly 99% glomerular filtrate is reabsorbed. Question number 117. Which of the following option has correct pair of the nephron maintaining the pH and ionic balance? So distal convoluted tubule and collecting duct is responsible for the same. Question number 118. Which of the following statement is incorrect regarding duct? So small amount of urea diffuse into the in from it extend from cortex to medulla. Large amount of water could be reabsorbed by to produce concentrated urine. Then small amount of urea diffuse into it from the medulla to keep the osmolarity. And it play a role in maintaining the pH. Okay, so here B statement is incorrect. Sorry, B option is incorrect. Question number 119. PCT, maximum reabsorption, so A3. Then DCT, minimum reabsorption, B1. Loop of Henle, ionic balance, counter current mechanism, maintain the concentration gradient in a medulla and renal capsule, is filtration of blood. Select the incorrect statement. Countercurrent system is contribute in a diluting urine. It is incorrect. It is concentrating urine. The ability to producing concentrated urine in vertebrate generally depends on length of loop of Henle. Which of the following statement is incorrect? ADH help in water elimination, making urine hypotonic. So it is a incorrect statement. It make urine hypertonic. Pick the odd one in each of the following group. So renal pelvis, medullary pyramid, renal cortex, and renal papilla. So in this renal cortex is odd one out. Then in second, vasa recta is odd one out. In third, glomerular filtration is odd one out, and in fourth, renal corpuscle is odd one out. Okay, so here option D is correct. Question number 124. Diuresis is a condition in which the excretory volume of urea is increases. Which of the following statement is correct with respect to the kidney function? When someone's drink a lot of water, ADH release is suppressed. The function of renin is conversion of angiotensinogen to angiotensin 1. 127. What will happen if the stretch receptor of the uterine bladder, sorry, it's a urinary bladder wall are totally removed. There will be no micturition. Question number 128. Which of the following is correct for a normal human? Presence of ketone body in which of the following is correct for a normal human? Relaxation of the smooth muscle of bladder and simultaneously contraction of the urethral sphincter cause release of the urine. So here D is correct option. Glycosuria is the condition where a man excretes sugar in urine. Consider the following statement. Atrial natriuretic factor can cause vasodilation, dilation of blood vessels. True statement. On an average, 60 to 70 gram of urea is excreted out per day. So wrong statement. 25 to 30 gram per day. Sebaceous gland eliminates certain substance like NaCl, urea, lactic acid through sebum. So correct statement. And PCT is lined by a simple epithelial brush border, cuboidal epithelial brush border for reabsorption. Okay, so here C is correct option. Family planning program was initiated in, so it was initiated in 1951. RCH stands for, so it's a reproductive and child health care. The option is correct. Which of the following statements are correct? So Saheli, okay, family planning was initiated through, according to WHO, total health is social, physical, and behavior health. True. Saheli was developed by CDRI Lucknow. True. Amniocentesis would not be banned, so it is false statement. Okay, so here 1, 2, 3 is correct. C option. Question number 134. Amniocentesis is a technique used in determine if any genetic abnormality is present in an embryo. Which of the following statement is correct? Amniocentesis is a technique detect fetal disorder. True. Reproductive health refers to healthy reproductive organelles. True. And India was the first country who started this program. So all of this are correct. Like in what is true about lactation amenorrhea? It means absence of menstrual. True. Ovulation does not occur, true. Chances of contraceptions are nil up to 6 months. Side effects are also nil. Increase in phagocytosis, so it is a wrong statement. And it is a natural method of contraception, so it is again true. Okay, so 1, 2, 3, 4 and 5, D option is correct. Which of the following is non-medicated IUDs? So Lipis loop is non-medicated IUDs. Multilode contained copper. What is the work of copper T? So it inhibit ovulation, it inhibits implantation of blastocysts. Okay, so C option is correct. IUD prevent pregnancy by physical and morphological change of uterine for implantation, phagocytosis of spermatozoa, suppressing mobility of sperms. So all of these are correct. Read the following statement. Copper T, copper 7 and multilode 375 are the hormone releasing IUDs. Copper ion released by some IUDs affect the ability of uterine wall to suppress embryo and thus cause contraception. So here both statements are incorrect. Copper ion released from copper releasing IUDs prevent. So it can suppress the sperm mobility. The birth control device used by women is so diaphragm, vault, copper T, all are contraception for women. All of this. The main disadvantage of intrauterine contraception device is the device are expelled out without the knowing of viewer. Which of the following is the drawback of IUDs? So there's spontaneous expulsion even without a woman's knowledge. They can cause excess menstrual bleeding and pain. Then risk of performance of uterus is high. Then risk of infection is also high. Okay, so here D option is correct. The most important component of oral contraception pill is, so it is a progesterone estrogen combination. Okay, progesterone estradiol combination contraceptive pill inhibit ovulation by, so it inhibit ovulation by a negative feedback of estrogen and of effect on FSH and LH. Progesterone pills help in preventing pregnancy by not allowing, so it's by not allowing implantation. How do the pill works? It inhibit ovulation, implantation, and it alter the quality of cervix mucus. Read the given statement and select the correct option. So Saheli is an oral pill which has high contraceptive value and very little side effect, and Saheli contain progestin with no estrogen and non-steroidal preparations called centrochromin. So both are correct statement. Identify figure. So first is condom, second is implant, third is copper T, and fourth is female condom. So D option is correct. Select the correct statement regarding subcutaneous implantation of synthetic progesterone. A 6 matchstick It is a contraception method. Then it acts by blocking ovulation and 6 matchsticks are implanted. Okay, so all of these are correct. Site of fertilization in a mammal. So it is ampulla only. D option is correct. Okay, again match the column. Oral pills prevent ovulation. Condom um, prevent sperm reaching to a cervix. So C option is correct. Figure represent vasectomy only. Consider the following statement. Okay. Lipis loop is a non-medicated IUDs while multi-load is copper releasing IUDs. Surgical methods. Okay. Statement C, high MMR and IMR play a significant role in decreasing human population. So here C option is correct. Question number 157. MTP considered relatively safe during first trimester and fetal become initially associated with the maternal tissue after the first trimester. So both are correct statement. Which of the following two statements are correct? MTP in the first trimester is generally safe. Correct statement. Generally, a chances of contraceptions are nil under the mother breastfeeding for up to 2 years. So wrong statement. Up to 6 months. Okay. Intrauterine device like copper T are effective contraceptive. True statement. Contraceptive pill may be taken up to 1 week after a coitus to prevent a conception. So wrong statements. Okay. So here 1 and 2, 3 are correct. Option A. Which of the following represent sexually transmitted disease? So all are sexually transmitted disease. Then which of the sexual transmitted disease are curable? So chlamydiasis are curable. In vitro fertilization technique that involve transfer of which of the following to fallopian tube? So either zygote or early embryo up to 8 cell stage is transferred in fallopian tube. Which part of the ovary in a mammal act as a endocrine gland? So Graafian follicle are act as a okay, pick odd one out. So scrotum, retrotestis, fallopian tube, and vas deferens. So fallopian tube is a female reproductive organ. So it is odd one. Then ovary, uterus, vagina, and ejaculatory duct. Again ejaculatory duct. Then acrosome, Graafian follicle, corpus luteum, and cervix. So acrosome is odd one. And in last, testes is odd one. Okay. So D option is correct. Match the following. acrosome, spermatozoa, endometrium, uterus, polar body, oogenesis, clitoris, rudimentary erectile tissue. Okay, so here B is correct option. Okay, select the correct pair. So haploid secondary oocytes, diploid primary spermatocytes. So it is a correct. Question number 166. So here both options are same, but option C is FSH and LH, and then I have to correct it. So here D option is correct, estrogen and progesterone. Accordingly, a diagram shows. So C is ovulation, then A is menstrual cycle, then B is proliferation, and D is secretory phase. Okay, so C option is correct. The phase of menstrual cycle in human that last for 7 to 8 days. So last stage of 7 to 8 days are a luteal phase or secretory phase. During proliferation, androgen stimulate proliferation of endometrium of uterine wall. Maximum thickness of the endometrium is deals with, so it's deal with a progesterone. In 28 days of human ovarian cycle, ovulation take place typically on. So it is typically on day 14th of the cycle. The time for optimum chances of contraception in a human is on a day of ovulation, 14th day. Ovulation in human female normally take place during a menstrual cycle. So just at end of a proliferative stage. Immediately after ovulation, mammalian egg is covered by, so it is covered by zona pellucida. Okay, you have to arrange the reactions. So first is secretion of FSH, then growth of follicles, then followed by sudden increase in LH, then ovulation occur, and growth of corpus luteum. So here B is correct. Which of the following event is correctly matched? Okay, lack of menstruation may be indicate pregnancy, correct option. Sorry. Release of egg at 5th day, wrong option. Endometrium regenerates in 5 to 10 days, correct option. Endometrium secretes, wrong option. Rise in progesterone 1 to 15 days, wrong option. Okay, read the following statement and select correct statement. Okay, lack of menstruation may be indicate pregnancy, correct option. The change in ovary and uterus indicate a change in level of ovarian hormone only, not exactly saying. LH surge induce ovulation, so it is a correct statement. So here 1 and 3 are correct. Sorry, Neet. Option C is correct, 1 and 3. If mammalian ovum fails to get fertilized, which of the following is unlikely happen? Okay, the estrogen secretion increase, it is not happen. Progesterone is rapidly increase. Okay, a human female reaches menopause around the age of 50, and cessation of menstrual cycle, matlab stop of menstrual cycle in woman is called, so it's called menopause. Okay, hope you done well in exam. See you tomorrow. Thank you.